Have you ever wondered about the best way to care for a surgical incision, especially whether it should be covered or left open to air? It is a common question after any procedure, and getting it right is key to a smooth recovery. The direct answer is that it truly depends on the type of incision, the stage of healing, and most importantly, your surgeon's specific instructions. Generally, immediately after surgery, incisions are covered with a dressing to protect them and promote initial healing. However, as recovery progresses, the approach can change significantly. The why behind covering or exposing an incision centers on creating the optimal healing environment. Initially, dressings provide a barrier against bacteria and physical trauma, helping to prevent infection and irritation. They also absorb any fluids that might come from the wound. Later on, sometimes exposing the incision to air can help keep it dry, which can be beneficial for certain types of wounds or once the initial healing has progressed past the most vulnerable stage. To care for your incision properly, always follow the detailed instructions provided by your surgical team. Typically, this involves washing your hands thoroughly before touching the wound, gently cleaning the area as directed, and changing any dressings exactly as prescribed. You will also need to monitor for any changes, such as increased redness, swelling, unusual pain, or discharge, and report them promptly to your doctor. Keeping the area clean and dry, unless otherwise instructed, is a universal best practice. A small insider detail is the specific type of dressing used can greatly influence healing. Some dressings, like certain silicone sheets, are used later in recovery not just to cover, but to help minimize scarring by providing gentle compression and a moist environment. Others are designed to be highly absorbent or breathable, each serving a particular purpose in the healing journey. Understanding the why behind your specific dressing can empower you in your care. Ultimately, diligent and personalized incision care is a cornerstone of recovery. By understanding the general principles of protection and proper healing environments, and by rigorously adhering to your surgeon's unique guidance, you are actively contributing to the best possible outcome. Your attention to these details helps ensure effective healing and minimizes potential complications, leading you toward a healthier, happier recovery.